Hello my dear friends, I would like to continue our videos regarding cosmetic and physiological dentistry, and let's talk today about proper posterior restorations and their connections to our smile preservation and preservation of our front teeth. Depends on how big the cavity is on the back teeth, premolars and molars, we use different restorations. If for the proper way of doing it is if the damage of the tooth about 10% small cavity, then we use composites. Composites, it's a plastic which is sometimes reinforced with the particles of the glass, which will basically clean up the decay and seal up the tooth and they last forever if the size of the restorations is small. If the size of the damage of the tooth is bigger, 25, 35, 45, 50, 60, 75%, then those restorations are not really suitable for this kind of reconstruction. I'll tell you why. First of all, because the composites are not so precise in the margin adaptation. Another disadvantage is that they're pretty soft. So if somebody is do have a big restoration, big composites on half of the tooth or 75% of the tooth structure, over the time it start wearing away, causing the bite of that person to collapse. So if somebody got like 4, 5, 8, 10 those fillings, big fillings on the back, over the time 3 to 5 to 7 years period, the bite start to collapse. And we see so many patients who comes to us and start complaining regarding breaking their front teeth. They see their teeth start changing the shape. They see the crack lines on the teeth. They see uneven margins of the teeth. And the first things we do, we take a look on the back of the teeth, what kind of restoration do they have. And if the patients do have those big composites, which is failing basically and wearing away, we immediately inform our patients that those restorations has to be changed in order to stabilize the bite and at least stop it in a position where it is right now, so the patient would not lose more of the tooth structures on the back, causing more damage to the smile, to the front teeth. So we usually take 4, 5, 6, 10 teeth on the back, minimum 4 teeth, which is usually the molars, and we remove those plastic fillings and we put custom-made, ceramic-made inlays and onlays. Those are kind of fillings made indirect in the lab, and technicians use very hard ceramic. It's highly cosmetic restorations. They are very conservative to the tooth structure. We use special bonding techniques, so those restorations are bonded to the patient's teeth with special techniques which has got chemical bond between the ceramic and the tooth structure, so they're pretty strong, and they got the same strength and the tooth structure, sometimes even more, and they keep the bite of the patient despite of the grinding, eating, or bruxing in the position where we put it by those restorations. And then when the bite is stabilized, we work on the patient's smile and we do the most conservative procedure and the most, very popular procedure, because it's not involving any restorations. We do cosmetic reshaping on the front teeth. We remove any uneven enamel. We remove any uneven margins. We polish the teeth the way they look like a brand new. We make the smile pleasurable, and we make the bite on the front lighter in order to shift the bite slightly on the back where it's supposed to be, in order to preserve beautiful smile, which we reinforce with the cosmetic reshaping, and the patients are very happy. And I want you, everybody, take a look at the mirror, and if you see any of those indications of start aging your smile, you see any crack lines, you see any uneven margins, you see that your teeth are not really even, you can always contact us, call us, come for consultation. We'll take a look and we check your back teeth. We see if there is a reason, is it composites, or what's the reason why you got this happens, and we'll help you out to keep your smile forever.